So the most important thing when you're looking for a functional medicine program is to make sure that it fits your goals and your needs. So here are a few questions that will help you to choose the program that will fit you best. The first one is this program focused on the theoretical, academic, or clinical application? So most programs will focus on the theoretical aspects of functional medicine, which is very interesting and it's good, especially if you're an educator or researcher. Now, you're going to learn the mechanisms of chronic conditions in most programs, but if you are a clinician, you really want to look for a program that is focused on the functional medicine labs and the treatment strategies, all the clinical, what we refer to as the clinical application. They'll help you eventually when you're sitting with patients that have diabetes, arthritis, metabolic issues, women's health conditions, or geriatric conditions, really understand what's the evaluation process, what labs should I use, how to analyze those labs, and then the specific treatment strategies for their condition. Another question to ask is, does the program include a review of functional and nutritional medicine labs? So functional tests are very different from the labs that are taught in the traditional medical programs. A comprehensive study of the theory without learning the use of the functional labs or how to view and analyze those labs to get the appropriate data for your evaluation is incomplete. And unfortunately leaves many practitioners out there struggling when they encounter real life cases or complex patients. So make sure that the program you're looking into is focused on a clinical application and treatment strategies, and also includes the use of the functional medicine labs, right? So those are two important questions to ask. The second one is, does it include a comprehensive review of treatment protocols? And if you can get a program that has treatment protocols that are specific to every condition as well, that would be a huge advantage. We recommend to look at a program that will cover at least, as minimum, the following labs. Now you can pause and take a look at it. You got all the variety of environmental labs, measure the liver detox pathways, different GI labs, food sensitivity versus allergy analysis, genomics, functional endocrinology. You also have the functional blood chemistry analysis, which most programs don't offer, unfortunately. But look for a program that really encapsulates all of those so you have a good wide understanding of these. Another question to ask yourself is this program self-paced or are there strict deadlines and set dates? Some programs require you to be present during the live training that might take a few hours or a whole day, or even commit to 4 or 5 days seminars over and over again. Well, some programs also have a weekly deadline or live lectures you have to be present, which means that you have to take time off work, you have to travel, you have to spend more money or more time away from your family. And so what we've decided to do is to have a completely 100% online and 100% self-paced, and that was designed for busy clinicians just like you that want to study around their schedule. Some of our students just do an hour here or a couple of hours there, and they can take time off whenever they want. There are no deadlines, and you have 3 years to complete the training, and you can grow your skills around your schedule and enjoy the process instead of being stressed about, oh, here's another seminar coming up, I have to finish this on time, and just stress about something. So here we prefer to give you a smooth, self-paced, much more enjoyable process, journey of learning. Here's another important question. Does the program include comprehensive clinical training in functional and nutritional medicine? So a good functional medicine program will teach you about chronic inflammation, the root cause, and give you some strategies. But will it be enough to prepare you for the challenges that patients bring? What about chronic pain and degenerative conditions? What about women and men's health conditions? What about anxiety and depression? What about genomic variations with patients, right? These are among the most common health challenges patients struggle will bring with them, and they'll be paying you to help them resolve their issues. That could be autoimmune, metabolic, men's health condition, geriatric issues. And so I would recommend to choose a program that cover specialty classes on those specific topics. You will have a better understanding of what's the treatment strategies for diabetes versus arthritis. You'll have a better understanding of a variety of complex patients and Lyme and reading genomic testing, right? And have very specific treatment protocols, integrating clinical nutrition and herbal medicine when appropriate for the right condition. So for that reason, we included very specific training on functional cardiology, autoimmune conditions, treating women's health, very specifically, most common conditions. Weight loss, a lot of patients struggle with metabolic conditions, with diabetes. What are the specific evaluation and strategies that we want to look at, and the pathways that we want to look at those specific labs? Geriatric, comprehensive neurotransmitter lab testing for depression, anxiety, neurodegenerative conditions, and of course treating chronic joint pain and degenerative conditions. These are among the most common conditions that patients bring into your practice. So make sure that you are getting the right classes and you are proficient in these specific conditions, not just the functional medicine, but also specifically what type of strategies and protocols do we use in functional, integrative, and nutritional medicine for these specific conditions. Those are all included in our program. Another important question to ask is this program being updated on a regular basis? And the reason for that is that there are thousands of new published studies every year that bring new information into clinical practice. And you want to make sure that you're not practicing based on an outdated information. The second reason is that in the functional medicine world, even the functional labs, for example, they're changing every few years. And so you want to stay current and get the most updated information. And unfortunately, most programs out there have not been updated in years. So if you get outdated information, that's what you're going to be bringing into your patients. While in our program, we have chosen to continuously invest the resources and the time and energy in order to update our program on an ongoing basis, literally every month. We updated our materials, so our students get the most current training. Another important question is, does this program include a practice building and growth training? Now, why would that be important? Because as providers, we invest so much time, money, energy into our medical training to bring the best skills we can and solutions to our chronic patients. But we get very little training when it comes to how to integrate functional medicine into your primary profession, how to properly communicate with patients the value of your services, how to build cash services instead of fighting with the insurance to get reimbursement for the services and the value of your skills, or how to establish and operate a successful practice. And so it's really hard to help others when you're struggling to make income or continuously keep fighting insurance companies to get reimbursed. So imagine owning your own time and getting paid well by doing something that you are passionate about and doing it in the right way. So this is why it is important for you to learn practice systems that will help you to automate your practice and increase your income and spend your time doing something that you're passionate about, that you love, and that you enjoy doing. So another question to ask, and that is really important, is what is the level of training? Is this program providing advanced medical training? Is this a coaching training, right? So there are coaching programs, there are practitioner level programs. These are two different levels of education. That doesn't mean that one is better than the other. It just means that you need to pick the program that will fit your level of education. So for example, a coaching program is typically open to everyone, and it's typically taught in a very basic level because it does not require any of the students to have previous medical knowledge. So you have to basically start from the fundamentals of healthcare, which is anatomy and physiology. and you can dive deeper into the mechanisms of the root cause. But a practitioner level program is only open to healthcare practitioners with knowledge and experience in healthcare, and it's typically much more advanced. This is where we dive into the mechanisms of chronic disease, and it's in much more detail that we just cannot do in a coaching level program. So make sure you pick the program that fits your level of training. So look for a program that fits with your level of education and experience, because patients who have been struggling for a very long time are going to depend on your skills and knowledge. And when it comes to your medical skills, we want to make sure that you get a comprehensive training, because it's not just your reputation, but also your responsibility to these patients. So when you're going to invest your time, energy, and money to really grow your skills in that aspect, then we want to make sure that you pick the right training for you and your goals. So if you're looking to provide your patients with answers to why they are sick and guidance towards better health using the functional, nutritional, and herbal medicine integrative approach, a shift from sickness management to really doing more of the preventative and corrective care, then our program is designed for busy clinicians who want to gain new clinical skills and offer comprehensive care to their patients. So you're going to offer something so valuable to your patients, and you'll give them incredible advantage over everybody else in your field. So I really appreciate you watching this. If you got any questions, or you want to get more information about our program, you can click in the link below, and take care for now. I wish you all the best.